Sinus node arrhythmias. Arrhythmias are disturbances in how the heart's electrical system generates or conducts impulses. They can come from the sinus node, the atria, the junctional tissues around the AV node, or the ventricles. Today we're starting at the top with the sinus node arrhythmias, since the sinus node is the heart's natural pacemaker. The three main rhythms here are sinus bradycardia, sinus tachycardia, and sinus arrhythmia. Sinus bradycardia occurs when the sinoatrial node fires more slowly than usual. In adults, this means the heart rate drops below 60 beats per minute. The tracing looks like a normal sinus rhythm in every way. The P waves are consistent, the QRS complexes are normal, and the PR interval is steady, except that the rate is slower. Sometimes this is a normal finding, such as in well-conditioned athletes or during sleep. But there are also clinical reasons for it, like hypothyroidism, vagal stimulation from vomiting or suctioning, or medications such as beta blockers and calcium channel blockers. It can also appear in patients with an inferior wall myocardial infarction. The real question is whether the patient is tolerating it. If they are stable and asymptomatic, no treatment may be needed. If the bradycardia is medication-related, holding or adjusting the drug may resolve the issue. But if the patient shows signs of instability, shortness of breath, chest pain, hypotension, or altered mental status, then intervention is necessary. Atropine, given as a rapid intravenous bolus, is the first-line treatment. If the heart does not respond, transcutaneous pacing or medications like dopamine, epinephrine, or isoproterenol may be used. Some patients with sinus node dysfunction, or what used to be called sick sinus syndrome, may eventually require a permanent pacemaker. At the other extreme, sinus tachycardia happens when the sinus node fires too quickly, generally over 100 beats per minute, but usually under 120. The rhythm remains regular and the P waves are present, though they may be buried in the preceding T wave because of the rapid rate. Sinus tachycardia can result from almost anything that stresses the body: fever, anemia, dehydration, pain, shock, or heart failure. It can also be triggered by stimulants like caffeine, nicotine, or amphetamines. Some patients have inappropriate sinus tachycardia, where the heart races without a clear demand, or postural orthostatic tachycardia syndrome, known as POTS, where the heart rate spikes when they change position. The problem with sinus tachycardia is that the faster the heart beats, the less time it has to fill between beats. That can reduce cardiac output and cause dizziness, hypotension, or even pulmonary edema if it persists. The key is to find and fix the cause. Treat dehydration with fluids, manage the pain, adjust the medications. Vagal maneuvers such as bearing down, coughing, or applying a cold stimulus to the face can sometimes slow the rhythm. Adenosine may be used as well. If the patient is unstable with low blood pressure or chest pain, synchronized cardioversion is the treatment of choice. For stable patients, beta blockers or calcium channel blockers can help control the rate. In rare cases where inappropriate sinus tachycardia persists, catheter ablation of the sinus node may be necessary. Treatment for POTS is tailored to the underlying problem, often with strategies to expand blood volume and reduce symptoms. Finally, sinus arrhythmia is an irregular rhythm that often follows the pattern of breathing. The heart rate increases with inspiration and decreases with expiration. On the electrocardiogram, you'll still see the normal sinus features: P waves in front of every QRS, consistent PR intervals, and a normal QRS complex. But the spacing between beats is irregular. Most of the time, sinus arrhythmia is benign and does not require treatment. Rarely, it can be associated with heart or valvular disease, but those cases are uncommon. To bring this together, sinus bradycardia is a slow but otherwise normal rhythm that only needs intervention if the patient is symptomatic or unstable. Sinus tachycardia is a rapid rhythm that requires investigation of the underlying cause and sometimes urgent intervention if it leads to instability. Sinus arrhythmia, in most cases, is simply a normal variation tied to respiration and requires no treatment. These rhythms form the foundation of our understanding of arrhythmias, and knowing how to recognize and manage them prepares us for the more complex atrial, junctional, and ventricular arrhythmias that come next.